C-Reactive Protein Test, also known as CRP test, measures the level of C-reactive protein in your blood. CRP is a protein made by your liver. It's sent into your bloodstream in response to inflammation. Inflammation is your body's way of protecting your tissues if you've been injured or have an infection. Some autoimmune disorders and chronic diseases can also cause inflammation. Normally, you have low levels of C-reactive protein in your blood. High levels may be sign of a serious infection or other disorder. High CRP levels can also indicate that there's inflammation in the arteries of the heart, which can mean a higher risk of heart attack. CRP test is sometimes confused with a high sensitivity or hs-CRP test. Although they both measure CRP levels, but they are used to diagnose different conditions. An hs-CRP test measures much lower levels of CRP. It is used to check for risk of heart disease. The hs-CRP test can be used to determine your risk of developing coronary artery disease, a condition in which the arteries of your heart are narrowed. Coronary artery disease can lead to a heart attack. Your doctor might order a CRP test in following conditions. Check for inflammation due to an infection, such as sepsis, which is a severe and sometimes life-threatening condition. Help diagnose a chronic inflammatory disease, such as rheumatoid arthritis or lupus erythematosus. An infection of the bone, called osteomyelitis. Determine your risk of heart disease. And evaluate your risk of a second heart attack. Normal values of CRP test. CRP is measured in milligrams per liter. Your CRP test is normal if CRP value is less than 10 milligrams per liter, and your CRP is high if it is equal to or greater than 10 milligrams per liter. Normal values of hs-CRP test. You have lower risk of heart disease if your hs-CRP level is less than 2 milligrams per liter, and you have a higher risk of heart disease if your hs-CRP level is equal to or greater than 2 milligrams per liter. If your results show a high level of CRP, it probably means that you have some type of inflammation in your body. A CRP test doesn't explain the cause or location of the inflammation. So if your results are not normal, your healthcare provider may order more tests to figure out where you have inflammation. The higher the normal CRP level does not necessarily mean you have a medical condition that need treatment. There are some other factors that can raise your CRP levels. These include cigarette smoking, obesity, and lack of exercise. If you have questions about your results, talk to your healthcare provider. So, that's all about the C-reactive protein test. Hope you like this video. If you want more videos of this kind, then keep sharing and keep supporting. Thank you.